This programme has been recorded and is not live. You're no longer able to interact with the show, so please do not call or text, as you may still be charged. Hope you enjoy the show. Another huge show tonight. Health waiting lists set to go through the roof. We've got explosive new figures. Trade unions threaten strikes over Stormont cuts. Are they right? How much will you spend to make your pet well? We've got TV super vet Nolan Fitzpatrick in the studio. And Gregory Campbell's in the suit after making fun of the Irish language.
Curry my yogurt, can cook a cooler.
And all that's happening in front of our live Nolan Show audience. Right, good evening. Tonight on the Nolan Show we can reveal that an extra 4,500 people will be added to hospital waiting lists every month. Now that's over 1,000 patients a week. Patients will be getting letters in the near future, but we're here to tell you about it right here tonight. What's going on? Well, the NHS has been sending some people to private health companies for operations. But now there's still health service patients. But in order to keep waiting lists under control, the government has been using private clinics. Here's the problem. They're turning the tap off because of cutbacks. So, what is going on? Let's discuss it with Mark Regan of the private healthcare group 352 and John Compton, the former chief executive of the Health and Social Care Board. Those figures are actually, when you look at it, well, is that scary?
It's scary from the perspective that you're starting out of 28,000 already breaching the ministerial target of 15 weeks to see their GP, from their GP to their consultation with a consultant, and you're adding 4,500 a month onto that. You're hurtling towards 30 to 50,000 by the time we get to this stage of the year.
So people will, look, let's just nail this straight away. So people will see you as a private company, therefore a vested interest. But what actually happens is these are NHS patients that are being sent to you, and when they're with you, they're still NHS patients.
Still NHS patients, and the crucial bit that has not been said in the airwaves locally in Northern Ireland for a long time, that we charge the same as the NHS. We use a tariff system. The cost of the NHS is the cost that we deliver them at. So we ain't fat cats. We don't make millions and millions of pounds. We charge the same structure and the same costs as the NHS to see these patients, which are still NHS patients.
And when we're told about turning the tap off, so what are you actually doing with those patients?
Well, at the minute, we have about 12,000 patients on our books and our computer systems at some point or another in their journey from first consultation through to surgery and discharge. I have about 4,000 who are ready to go for surgery, could go for surgery tomorrow morning at the same cost as it would be for the surgery in the NHS. But we've been told by the HSC and various trusts to stop, Health and Social Care Board, to stop doing those patients and pause. Put them in a cupboard and we'll tell you what to do with them at some stage after April 2015.
So you're ready, you've got the ability, you're ready to do operations on 4,500 patients.
Absolutely.
And you've been told stop.
Stop.
And meanwhile those patients aren't being sent anywhere else.
They're sent nowhere else. We've informed the patients that they're stopped. The trusts are also informing their GPs that they're stopped, but the patients are going nowhere from now until April 2015.
Okay, so the 4,500 I get, right? So they're just not being looked after now, okay? But that's every month, because the tap is completely turned off. So you're not also, that's building up, that's going to grow and grow.
4,500 I have are surgical, they're ready for surgery. The 4,500 you're talking about are people coming into the system that will eventually join surgery.
That's additional.
About 1,500 additional going on to surgery as well.
What type of surgery are we talking about?
Spinal surgery, hip replacements, knee replacement, debilitating things, as well as minor things. But on the whole, these are things that affect people serious enough for consultants to say, I need to take you to an operating theatre.
John Compton, what is going on? I'm not entirely sure the public understand what is happening here, because that's a snowball effect. If that tap is being turned off and 4,500 people are being sent a letter to say, that's it, you're out, the tap's turned off, and more new people aren't allowed to come through, this is going to snowball into a huge problem.
Yes, it's going to be a very difficult problem. I think there's a couple of things I would say. First of all, the health system works very closely with the private sector, has always worked very closely with the private sector, and there's no issue as far as that is concerned. The second thing is about 5% of the work that's done is done through the private sector. So 95% of the work will happen routinely and ordinarily. And also the work that's deals with, if you like, the most serious conditions will happen without any cataracts. What happens is that people get referred because the demand and capacity, the statutory sector isn't big enough. It can't deal with it. And whenever government has to control cash, one of the things that it can do to control cash is reduce the amount of people that get to have outpatient and elective surgery.
It depends what you define as serious, though, right? Because life-threatening, obviously, is a type of serious, and those people are going to still be seen. But actually, if you're sitting, no matter what age you are, but let's take, for example, an elderly person that needs a hip replacement. That's serious to them.
All of this is very serious. I mean, the 4,500 people, sometimes you can talk about numbers and they're sort of anonymous, but they're actually all people. And Mark is quite right that you have people who will be waiting for cataracts so that they can improve their vision, and their sight. Older people, they'll be waiting for some orthopaedic procedures which perhaps will make life more comfortable for them in terms of pain relief, and the quality of their life will be different. But in the end, any health and social care system can only deliver the amount of activity that it is given the money to deliver. It can't do things that it doesn't have the resources to deliver with. There's a serious issue to talk about how we handle all of that.
And people are going to look at you and your company and companies like you, and they're going to say, we don't care about the fat cats. We don't care about the private sector. All of the work should be kept in the NHS, and you don't care about the patient. You're in this to make money, and now you're feeling sore.
Well, the vast majority of people that in my organisation in the management director role come from the health service, myself included. I've worked at the coalface for many years in the health service. I understand the frontline staff and how demoralising it is for this type of thing to come out in the news, such as Valerie Watt said today. So I support all of that. It is fantastic. But fat cats, we're not. We charge exactly the same as the NHS, and yet we turn a profit. That's because we're efficient. We must be efficient, or we would not be here tomorrow. Contrast the 5%, however, that John has said that's pushed out to the independent sector in Northern Ireland. That's upwards of 10% in the rest of the UK. In England, the waiting time from your GP in Northern Ireland until you see the consultant, till you get diagnostic, CT or MRI, until you get your surgery, put it all together as a composite, it's about 48 or 50 weeks.
48 to 50 weeks in Northern Ireland. It's 18 weeks in England.
Ministerial target, 48 to 50 weeks. In England, as you say, 18 weeks start to finish.
So we are going to be waiting 3 times more here in Northern Ireland than you do if you're a citizen.
You pay the same tax for the same system, but a different way of managing it.
Clearly the issue here is when you have an amount of money that runs a health service, which is free at the point of delivery with no defined benefit, it costs about 6% additional resource each year. If you don't get the 6%, then you have to control the cash, because you can't spend the money you haven't got. And the consequence of that is that there will be people waiting. Now nobody is comfortable with that. Nobody I've spoken to.
How come they can do it in England far better, far quicker?
I think I doubt they can do it in England. And if you've been watching the press in England, you'll have seen recently all sorts of debates about the fact that they are several £billion short in money going into the future, and that they're breaching a lot of the targets that they have in terms of 18 weeks. So
they do it at 18 weeks or thereabouts.
Yes,
be that 20 weeks and 21 weeks gets serious.
And what do you see it becoming because the tap's being turned off?
Well, the tap turned off. The figures that I've used are ministerial targets, and they're that composite target of 15 weeks and 9 weeks and 20, and you put it all together and you get 48 weeks. That's what the minister says it should be done in. The figures that we have there published, for not my figures but Northern Ireland Audit Office, tell me that there's 28,000 people in June, the first quarter, breached that first target. The second bit of the target, 14,000 breached in diagnostics, and the third part of it, the bit you wait in surgery, about 5,500. That's when using the NHS, using the independent sector.
Yeah.
That's been turned off. So those numbers add 4,500 every month.
So paint the picture for me. Paint the picture, a general picture of what Northern Ireland's going to look like next year for people if the tap stays turned off.
All I can tell you is it'll be very bleak, and don't let anyone be fooled by the fact that ministers have decided to ring fence health at the purpose of university
failure.
We're
hearing a rosy message from Stormont, aren't we, about health, that the health budget is protected.
As John has said, it's protected in its 2% growth or a percentage growth. It needs significantly more for the ageing population which we experience in Northern Ireland, and the way we deliver healthcare services has to change drastically. Not small tweaks, but drastic change.
Do you agree with him? The situation looks dire.
I think the situation looks very difficult indeed, very difficult, and it will get.
What's difficult mean?
Well,
is it dire?
Yeah, well, dire. I mean, I don't like using emotive language. I think it's more.
What if you're sitting on a waiting list for a year,
I think it's more sensible to talk about the practical things. Well, 95% of people are inside the statutory system. We're talking about the 5% who are in the independent sector here. So there's a perspective here that's important in the middle of all that. Nonetheless, as I've said before, the 4,500 people, or whatever numbers of thousands, they're human beings, they're individuals, and their life is difficult if they have to wait longer. But we really do have to face the fact in Northern Ireland that with the health and social care system such as we've got organised, we have to think more responsibly about how we're going to see it into the future, because if we don't, there is really no point in finger pointing and saying it's the politician's fault, it's the Health Service Administration fault, it's the doctor's fault, it's the private sector's fault. We simply know that we need 6% money per annum every year, and if we don't get it, then people will have to wait.
Do you know the other thing that strikes me though? This comes down when you talk about the NHS and free access at the point of delivery and all this kind of stuff. What this is going to come down to in Northern Ireland, from what I can see, is that if you've got the money to pay a boy like you, you're going to be seen within weeks. And if you're working in this country and you're a hard-working citizen and you're earning a decent wage but not big money, you're going to sit for a year on a hospital waiting list, right?
Yes, absolutely.
You absolutely do. You're right, Stephen. You do risk the double standard. You do risk the standard that if someone has the availability, they can pay for it, and if somebody hasn't, they can't.
So it's a two-tier system we're looking at. That's what's evolving here.
If you're not careful, that's what could happen out of it. But I think the really serious debate is to have a debate about what we want in terms of our health and social care system, because we have the capacity to fix these things. That's the very sad thing, and we have done a tremendous amount in getting them into a very good position. And what's sad about it is to see it deteriorate again.
Listen, let me thank the Health Minister tonight, Jim Wells, because thousands of people will be sitting in this waiting list, and Mr Wells just couldn't make time to come onto the programme tonight and talk to Northern Ireland. So I know you're a new Health Minister, Mr Wells, and it's really, really good, Jim, that you're putting yourself out there in front of the country to tell people. Really, really good. I'm just sitting thinking, Jim, as you sit in your ministerial job and you have your minister's post now and you have your minister's title, I'm just thinking, Mr Health Minister, of that 70-year-old pensioner who's looking for a hip replacement and you can't be bothered coming on the programme tonight. So thank you very much indeed. Right. The Health Minister or his department did issue a statement. They say, unfortunately, the challenging financial position and the difficult measures undertaken to address it will inevitably lead to an increase in waiting lists. This is extremely frustrating, given the significant progress that has been achieved up to this year. However, the health and social care system will continue to provide safe and effective care to patients based on individual clinical need. Those in greater or more urgent need of care will continue to be prioritised appropriately. That from the Health Minister. John, thank you very much. Thank you, sir. Give them a round of applause. Thank you very much. Okay.